Hello, my name's Karen Fergus and I'm one of the physios at Back to Balance Physiotherapy. And welcome to day one of our modified Pilates exercise program for Back Care Awareness Week. So the exercise I'm going to teach you today is a classic Pilates exercise called the hundreds. Okay, so we're going to bring ourselves down onto the mat and put ourselves into the rest position, which is pretty much the starting point for all of our exercises on the floor. Alright, so I'd like you to bring your feet together, turn your toes out, turn your heels out, and that should more or less bring your feet and your knees in line with your hips. I want you to gently draw your chin in towards your chest, glide your shoulders down, away from your ears, and gently open through your collarbones. Make sure all of your upper back and your chest are connected to the floor. We're now going to find our neutral position, okay? If you make a pelvic diamond, holding your thumb and index fingers together, place your thumbs into the belly button and your index fingers will sit on top of your pubic bone. Now I want you to very gently lift your tailbone up towards the ceiling, flattening your lower back into the floor. We're going to reverse that now by tilting the tailbone downwards into the floor, increasing the arch in our lower back. If you can repeat that again, tailbone tilts up and tailbone tilts downwards. I want you to find now that mid position between those 2 points. If you were to look down now to your thumb and your index fingers, they should be more or less horizontal, meaning that our lower back is now in its neutral spine position. We're now going to support that by engaging our core. I'd like you to take a breath in, and as you breathe out, lift up your pelvic floor muscles and draw in your lower abdominals. Okay? So now we'll start the hundreds exercise, and you're going to try and keep this lovely aligned position whilst we do that. Let both arms hover off the floor, take a breath in, and as you breathe out, start to beat the arms in a small motion by your side. We're going to try and have 5 beats to an in-breath and 5 beats on an out-breath. Okay. Make sure that your lower back is staying in its neutral position and that your centre is engaged. Now if you find that that's quite easy, we can try and make it a little bit more challenging by slowly lifting one leg up into the tabletop position and holding it there for 5 beats. And we can change to alternating legs, making that a little bit more of a challenge. Okay, so those are your exercises for today. I'll see you all tomorrow.